Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Spinal anesthesia and the dermatomal spread of the factors. So let's begin with the drug factor. So what is the most important? So let's look at what is more important. So the more important with the dermatomal spread of the spinal anesthesia, it includes the dose. It includes the dose as well as the baricity. So dose as well as the baricity. Next, it includes the patient factors. So we are dealing with the most important. The patient factor, it includes the CSF volume. Next, it includes the advancement of the age as well as the pregnancy. Next is we look at the procedural factors. So in terms of procedure, it includes the patient position. So it is the position of the patient and also the epidural injection post-spinal. So the epidural injection, that is post-spinal. Next we look at what is the less important. So less important factors, it includes the along with the drug. So related to the drug, it is the volume, it will be the concentration, it will be the viscosity as well as the additives. Now let's look at the patient factors. The patient factors is that it includes the weight, it includes the height, it includes the spinal anatomy. So it includes the weight, height as well as the spinal anatomy. Next is the intra-abdominal pressure. So intra-abdominal pressure, we call it the IAP. Then lastly, there is the procedure factor. So what will be the procedure factor? So procedure factor under less important, it will include the less level of injection. So it will include the level of the injection. Next is the needle orifice direction. So the needle orifice direction. And then will be the needle type. So what will be the needle type? To learn and grow daily like this, please do subscribe.